validity of ambulatory blood pressure monitoring for the diagnosis and control of hypertension. Ambulatory blood pressure device is a portable monitor connected to a standard inflatable cuff using an oscillometric technique. The cuff will inflate and deflate at regular intervals over a 24 hours period to measure the blood pressure. It is programmed to take readings during the day and sleep times at set intervals, 15 to 30 minutes during the day, 30 to 60 minutes at night. The first study published in 1962 demonstrating the assessment of 24-hour blood pressure without an observer using a semi-automatic method, which is recently designated and called ambulatory blood pressure monitoring. This picture clarifies the evolution of these devices over times. This trace represents I can say, the first ambulatory blood pressure traces, which is presented in the Brazilian Congress of Cardiology. The first and the earliest indication on which the ambulatory blood pressure device was designated is white coat hypertension and masked hypertension. Later on, the validity of this device was recognized more in the diagnosis of nocturnal hypertension, hypertension despite appropriate treatment, patient with a high risk of future cardiovascular events. Again, ambulatory blood pressure may be useful for refractory hypertension, titrating antihypertensive therapy, borderline hypertension, hypertensive detected early in pregnancy, syncope, or suspected orthostatic hypotension. The validity of ambulatory blood pressure monitoring, as I say, was recognized more with nocturnal hypertension, which is first described in 1988, where the nighttime dip has become an accepted measure for cardiovascular risk. Again, the recognition of the validity of these devices in the four following categories of blood pressure dipping, circadian variation, the nocturnal dipping, the non-dipping, the extreme dipping, and the reverse dipping. This curve demonstrates the nocturnal dipping in blood pressure during night at sleep time, involving both the systolic and the diastolic blood pressure between 10 o'clock p.m. up to 6 o'clock a.m. in the morning. Again, the validity of this device and the reduction of incidence of stroke, heart diseases, organ damage, in addition to cardiovascular events due to hypertension that involve the myocardial infarction and the sudden cardiac death. The disadvantages of this device involve some discomfort, soreness in the upper arm, interference with the sleep while blood pressure measurement during night, irritation of the skin with a mild rash. It is not recommended in patients with irregular heart rate and arrhythmia. Take-home message, consideration of this instruments, apparatus, bill management, and follow-up of patients, specifically those with hypertension, diabetes, CKD, obesity, hyperlipidemia, etc. Thank you.
Thank you for you, Dr. Najeeb.